Hi, I'm Paris, and as I've been posting on this channel videos about my experience having prostate cancer and going through chemo right now, I've had some viewers ask me to go back and start at the beginning of the story where I first found out my diagnosis and what things I looked at and how I made my decisions about my treatment. So in this video, I'll go back 6 months, which is when I first got a strange test result, and that started the whole process. But really to go back to the beginning would be to go back 20 years or so, 20 years of being overweight and having a poor diet and poor lifestyle. That's really where the cancer came from, I believe. But in terms of finding out about it and trying to combat it, it was 6 months ago. I had my twice yearly health checkup scheduled for August. It was going to be a telehealth visit, and the doctor had put it in order to have some blood work done beforehand to go over those results. So I was expecting to see that my blood sugar was continuing to improve, the A1C, the insulin, my cholesterol, and so forth. I was just expecting an attaboy kind of visit because my numbers were all going to continue to improve. But I remembered at my previous visit back in January, 6 months before, that my doctor had said, how about when we do your blood panel next time we include a PSA test? You haven't had that done in, I think it was, 12 years or so. So I did my blood work a week before my appointment, and I knew that 2-3 days later the numbers would probably be in. So I was anxious to see how good those scores were. So I logged in. I remember it was in the evening, sitting out on the sofa in the living room, and the first numbers that came up were, the blood sugar is doing even better, and the cholesterol was still in a really good range. And then I remember, oh, that's right, there's the PSA one they did this time, and I scrolled down, and I thought, because they bold face it if it's outside of the normal range, and I couldn't remember exactly what normal was, but it sure seemed pretty high because my PSA number was 38. And I guess it did have the normal range listed right next to the result, and I remember that the cutoff for normal was 4, and my number was 38, almost 10 times as high. So it was a shock because a whole bunch of implications went through my head immediately. So with my heart now beating much faster, didn't mention anything to my family sitting in the living room, but I brought up a browser window and put in PSA results, and I knew they were awfully high, and so I read a couple different websites, information about a test result that high not only meant that I most likely had prostate cancer, but being that high that it may have actually spread already. So pretty much in a state of shock, I excused myself from the living room, came to the bedroom by myself, went into the portal messaging system and sent a message to my doctor saying, I noticed my PSA results are scarily high. Should I make an appointment right away with my urologist, because they're the ones that go in and check that sort of thing out? Also, do you think I should have a retest done just in case something happened? Because I really was in disbelief, because I felt fine. I felt better than I had in years, having made the improvements to my health, lost all that weight. I was feeling so much better than I had been. How could that number really be my number? So I put away the computer and distractedly went back out with everyone in the living room, had TV on or something, but my mind was thinking of so many other things the rest of the evening, had a lot of trouble going to sleep that night. The next morning, I thought of some more things to look up. I actually decided, I think by 10 the next morning, I'm just going to go ahead and make an appointment with the urologist based on these test results. And I started thinking, I need cancer treatment. Where am I going to go? Well, here in Texas, there's a famous cancer center. So I started looking up information about that and if I would be able to get in to be seen by them. So my mind was going many places far in the future. That evening when my wife got home from work, then I brought her to the bedroom and told her my blood test results. Now, it doesn't necessarily indicate this, but it sure looks like it could be. So I explained things, trying to put a more positive bent to it all, but still, she was absolutely shocked and in disbelief as well. We decided this was just one test result, no sense worrying the kids about it, or my father back in Seattle, or my brother. So, okay, we'll just keep this to us. Maybe they'll do another test. Maybe it was just the wrong test. Sometimes they swap out the wrong blood samples. It can happen. I believe this is what they call the denial phase. I mean, it's kind of a little bit of a blur, but I'm sure I must have been looking stuff up each day until that visit, trying to learn more about this. So the appointment day came, and my doctor, to my surprise, started out with, well, your blood sugar's looking good. Oh, the cholesterol, yeah, that's great. You're keeping that such a good range. And then finally got to the PSA number and said, well, this number, I'm glad we ran this test because it looks like your number is really elevated. They said, sure, let's go ahead and do another test just in case. And definitely keep that appointment you have with your urologist and let them take it from here to see what's going on. So I went the next day, did the blood test. It's not a test you get those immediate results for, though. It seems to take a couple days. And so, yeah, before I went to my appointment with the urologist, I did get the results in the portal of the PSA, which it was 38 that first time. It was 32 the second time. And I thought, well, that's, just variation, but still, it's in the 30s. It's still incredibly high. The doctor also said she was running a more specific test that's more indicative of whether it's actually cancer that's causing this. And it was, I think, a free PSA test. So the free PSA guidance said with this number that I had, 75% or greater chance of it being prostate cancer. So yeah, the denial had to go away, and I had to accept this is pretty likely what's happening. It was 3 or 4 days later that I got in to see the urologist, and they did the digital rectal exam where they put a finger in there and can feel the prostate. And they said the prostate didn't feel especially large, but they did feel a nodule on it, something poking out that shouldn't be there. They also went over my test results, the first PSA, the second PSA, the free PSA, and said there's a good chance you have prostate cancer, and so the next thing we're going to do is an MRI. And I don't remember exactly what they said. It was like a T4 MRI, something that a lot of MRI places don't do, but they did have one place in Austin that had a machine that could do that. So they got me scheduled for that appointment. It was a week or 10 days out before they could get me in for that, and I updated my wife with the news, so kind of had to come to accepting this was likely going to be prostate cancer. Didn't tell anyone else yet, though when I got home from that appointment with the urologist with the likelihood I was accepting in my mind of having prostate cancer, then I made a call to that specialty cancer center here in Texas, and I'm not mentioning them by name just because I'm going to talk about them a little more specifically later on, so I'll just leave it as it's a famous one. And I talked to them, went through all the registration and verifying the insurance, and I had my test results, so I was able to send that over. But they said usually we work with people when they're diagnosed, so you don't have yet an actual diagnosis. You have these unusual PSA results, but it's probably will work better for you. Once they finish doing the diagnostic tests, then that'd be the time to come to us. So, okay. Tried to go back to regular life, waiting for my MRI exam. The day came, did that procedure. Of course, they never tell you anything, though they're looking at the thing right there, but they don't tell you anything. They said, okay, we got good images, so your urologist will let you know when they're ready to talk to you about it. So that was another 10 days or so of waiting, and when I had my appointment, they didn't show me scenes from the MRI, but they showed me the report, which verified that yes, it was, from everything they could see, it was cancer, and some of it had extended outside of the prostate. The next step, he told me, is the prostate biopsy. Now, I had known this was going to happen, and I had read things about it, and I was awfully nervous about it. But the doctor was understanding of that. He said, this is just something we've got to do. And I said, yes, I understand that. To do the prostate biopsy, they have to take hollow needles and insert them from the outside of you down there into the prostate so they can take like a core sample, sort of like they do with the ice in Greenland or the South Pole to analyze it. They jam that down there and pull out a chunk of ice. Well, they're going to pull out little chunks of prostate tissue, 12. So it's basically getting that hollow needle inserted 12 times, and they do it in different places in the prostate because they want to see how much of the prostate is cancerous, how much it might not be, and if there's, I don't know, they do examining of that actual tissue that they pull out. Now, I guess from the look, maybe horror on my face, the doctor said, now, if this is going to be a deal breaker for you, we can do it under anesthesia. We'll have to go to a surgical center, so we'll have an anesthesiologist and they'll put you under, we'll do the procedure and you wake up. And the insurance may or may not pay for this, but we can do it right here in the office. It's a simple procedure. I've had mine done, he told me. He said, we'll give you a relaxant and it's over real quick. And so I really wanted to take the option with the being put out to do it, but I thought most people don't do this. It becomes a macho thing. Well, if the other guys can have it done, I think I should be able to have it done too. So I decided that I'd go ahead and have it done in the office there, just with a little relaxant that they would give me in advance. And hey, the doctor had had his done there too, so if he could do it, I could do it. So from what I had read about it on the internet, I was so nervous. Even though I've had a biopsy before, when I was 30, I had a thyroid growth. I was traveling around the world at the time. I was in Australia, and they needed to do a needle biopsy. They didn't even give me any relaxing stuff or any anesthetic. It was, I remember it very clearly. I remember the guy coming at me with the needle and going right into the thyroid. That was unpleasant, but it wasn't terrible, maybe because I hadn't gone on the internet and read about the procedure in advance. So it was another week or 10-day wait to have the biopsy done. I'm thinking, geez, I pretty much knew how many weeks that we're going on 5 weeks ago. I saw the PSA test results. I was pretty sure I probably had cancer. And yet here we are just testing. Well, presumably the cancer is continuing to grow. Shouldn't we be doing something for me? But this is the procedure you have to go through. So as the day got closer for the prostate biopsy, I was pinning all my hopes on the mild sedation that was going to get me through this. Plus the fact that, come on, all these other guys have this done. I have to be able to do it too. So went in early in the morning. I had read, because I'm still reading more stuff on the internet, working myself up about this, that they have you go in early when you're having that kind of sedation so that it has some chance to take effect. In my case, it was going to be a Xanax, I think, in pill form. I'd never had that before. And I went extra early for my appointment to make sure they had time to give it to me and it had time to take effect before the procedure. But then I'm just sitting in the waiting room. This is COVID times, of course. Everybody's spaced out and there you're dealing with a million other things and taking people's temperature and asking all the COVID questions. And I thought they had forgotten about me. And it's getting closer to my procedure time. But it turned out in the procedure time, they factor in giving you that and giving it some time to take effect. But I was, oh my gosh, they didn't leave enough time to give me the Xanax and have it take effect. But they brought it out to me, took that. Then it was into a little side room for an antibiotic shot, because they're going to be basically poking right next to your rectum into organs of your body. There's certainly a chance for infection, so they give you antibiotics by shot in advance, so you already have those circulating in your system in case something unpleasant gets introduced into your bloodstream. So that was a fairly big shot in the butt, and then down to a changing room to put on the paper gown, and then down to the procedure room, and there was like a whole group of people. I was expecting it was just going to be my urologist there, but it was like a team of people in there. They had me lie down on the table on my side and adjusted me this way and that. And then so they can know where they're aiming the biopsy needles, they do a transrectal ultrasound. So there's the ultrasound technician with the ultrasound machine, and they have to get I didn't see what it looked like. I'm glad I didn't look. Anyway, they have to get the ultrasound device right up next to the prostate. So they basically use a lot of lubrication, and they put it inside of you and get it so they can see what they're working with. And then I don't remember what all the people were doing. The Xanax was finally taking some effect, which was good. And so it definitely helped. Did they do anesthesia? They must have done some anesthesia, right? Gee, I can't remember that. And I obviously didn't see what they were doing. It was all happening behind me. I'm guessing they must have given me some anesthesia, but okay, don't quote me on that. And I remember them taking the course, I remember it wasn't nearly as bad as I was expecting it to be. I thought it was going to be, you know, life-changingly awful, and it was unpleasant, but it was uncomfortable because, you know, they announce what they're going to do, and you just kind of tighten up because you know they're going to stick another one in there. And I was counting as they did them for them to get all 12 done, and it went pretty fast. 10 minutes, less than 10 minutes, I think, of the unpleasantness. And then, as soon as they had gotten the last of it, I guess they took the ultrasound transceiver out, and they wheeled that whole machine out, and the whole group of, I don't know how many, 8 people or something, whew, they were all gone. They handed me like a roll of paper towels to clean all the lubricant stuff. And then, you know, here's your clothes. Go ahead and get dressed and go up front. So they got what they wanted. They all left. Because I was having the Xanax, I couldn't drive myself home. So my wife drove me to that appointment. And I came out kind of spaced out and stunned by everything that had happened and the drug-induced state I was in. So it wasn't terrible even afterwards. There was discomfort, but the overall, I had made up in my mind the whole prostate biopsy procedure being 10 times worse than it actually was. But if you find out you have to go in for this procedure and they give you the option of the Xanax, definitely take it. After that, more waiting. Was it a week or so? I don't know. They have to send the stuff out and they have to culture the cells, because now they're actually determining not just that you have prostate cancer, but that they can find out some details about the cancer. Is it a more aggressive, less aggressive? Of course, they can see how much of the prostate approximately has cancer in it. And so then I got the call that it was time to go in for that appointment. And they showed me the paper, which has a thing like a prostate, and it's divided up in a grid, and it has numbers in each of those. And it tells you, as I understand it, basically how cancerous each of those sections is. And in my case, I think it was most of the sections had a cancer. And I got a Gleason score of, was it 8 or 9? Anyway, not a very good score. It means it was a lot of cancer. The prostate was sort of chock-a-block with it. My urologist didn't tell me directly what stage cancer I had. I didn't think to ask. Turns out it actually did say on the form, but I didn't really see how I was reading it. And in any case, my urologist said, well, so now we've determined this, so I'm going to hand your care over to another doctor, because I pretty much just do the diagnostic stuff. When it comes to treatment, another doctor in our practice will be helping you, which I kind of sort of felt abandoned at that point, because we'd been through so much together, and here he is going to hand me off to someone I'd never met before. Also, my doctor, who I've been going to for my twice yearly visits for years and years, and the one who talked to me originally about my PSA score, said that all my other numbers were so good, my blood sugar, my triglycerides, cholesterol, all that, well, I don't think I need to see you for a year. So that was in August, and they said, well, we'll just schedule you for a year from now. And I was feeling a little abandoned in that case too, because this is a doctor that I've been seeing for years and years, and I would like to have their input on this thing I'm going to go through. And I know they're not a specialist, but they're someone whose medical opinion I value, and they're going to send me to some urologist I never met before, and they're going to just tell me, do this and this. How am I going to know if that's good advice or not? So I was feeling pretty abandoned by my medical experts. I was reading a book about someone's experience going through having prostate cancer and how they used changing up their diet and lifestyle and becoming healthier to help fight it. So there were some good lessons in that. There were also some things that had me worried. But one thing they emphasized is you had to have your team, so your medical team of doctors who provide different specialties and services that were going to take care of you. And I really felt I had no team whatsoever at this point. The only 2 people I'd had the regular contact with about this were saying, well, good luck with that. So maybe I didn't mention, after the MRI pretty much confirmed it was cancer, I did get back in touch with the famous medical center here in Texas, told them about that, told them I was going to have the prostate biopsy, but pretty much I needed an appointment, and so I was glad they were able to get me in just a few weeks' time. I didn't have to wait too long. So it was not long after the prostate biopsy that I was off to their town. I guess I can tell you it was Houston. Went to Houston and started the whole adventure with them. But I think that'll be part 2 of this story. What happened there, what happened when I finally did meet the doctor in Austin that I was being handed off to by my urologist, and how I ended up getting here having the treatment that I'm having it now. But one more thing, it was time to tell everybody else the news that I had prostate cancer, and it wasn't just a little bit of prostate cancer, it was fairly serious prostate cancer. So told the children about it, and tried to put the best face on it as possible. And my daughter asked me, she said, well, what stage is it? She's big on the youth fiction stories, and I know there's lots of cancer stuff in the stories these days, and so she knew what stage would indicate the likelihood that you'd be able to recover. And I didn't know, because the doctor hadn't told me clearly. So I just explained what they found, and that likely I would need surgery, radiation, some treatments like this, but that generally prostate cancer didn't tend to be a fast-growing cancer, as in, well, it's October and we don't know if you'll be around at Christmas. It's not usually like that. So usually it can get you in the end, but it generally takes a while to get you. I didn't put it like that, though. I did emphasize with them that I was going to this famous cancer treatment center, maybe best in the country, certainly one of the best in the country. So I was going to get the absolute best care, and anything that could be done for me would be done for me. So we'll fight it and get the best of this. There were tears and there were tears and hugs, and it's I don't know. I mean, I felt so bad having to put that on them, because just imagining it from their perspective, what a hard thing to have to hear and to come to accept is the case. But my wife was good, emphasizing to them, we're going to do everything possible. There are lots of different kinds of treatments, and so she just focused on the optimistic, positive side of things. So that was helpful. But I needed to tell my father and my brother, and those were difficult calls to take. My father's in assisted living up in Seattle, and at that point I don't think I'd seen him since the Thanksgiving before, so it'd been like 9 months. Normally we would have traveled up and seen him over the summer, but because of the coronavirus and he's in an assisted living place, there was no way we were going to be able to get in and see him. So in fact, nobody had been able to go in and see him for a number of months. So you feel terrible laying this on your kids and then laying it on your parents. I think I actually called my brother up in Washington State and talked to him before my father. I asked him to call my father after I'd had a chance to talk with him, just so my father had someone to talk to and express his concerns, his feelings of grief, whatever it is. We're not a particularly touchy-feely family on the male side. My mother, who's no longer with us, she was a very people kind of person, and so with her I could see how it would have been different. But we're all a little bit, I guess, on the stoic side with my father and my brother, but it still doesn't mean it's not tearing you up inside. And so I wanted to make sure my father had somebody he could talk to. What I didn't know till later is that my brother actually took it kind of hard. And yeah, I only heard from him maybe a couple months later about that had been such a rough week for him. And I think, well, the doctors weren't at all clear with me. As I told you, the urologist said, okay, well, we're done diagnosing it. Now you're off to see this other doctor who will help you deal with it. But nothing about, he didn't clearly come out and say it's this stage cancer, didn't say, and maybe you're supposed to ask, but I would assume they would tell you, oh, you have pretty good odds, or well, we can do a number of things to give you some extra time. And with with some cancers, it's months. When you're diagnosed, you have a matter of months. With some cancers like prostate cancer, it turns out it's often, unless I guess it's very late stage, it's often a matter of years, even if they can't cure it. In a number of cases, they do cure it, and if they can cure it, well, then you go on and live your regular life. So I think my father, my brother, and myself were all sort of, wondering in our minds, well, will Paris still be there at Christmas? Or, we really didn't know. And it seems like some doctor along the way should recognize that the patient who gets this news must have these kinds of questions, because in popular culture and movies and TV shows what it's usually like when someone has cancer. So tell them, but I think nobody wants to talk about it, even the doctors, even my urologist who diagnosed it, even my regular doctor of many years. Well, okay, now we're going to send you off to this person for will take care of treating you. But nobody wants to have that talk with you that starts out with the patient saying, "Give it to me straight, doc." I guess unless you force them, they'd rather not. I don't know, maybe if I were a doctor, boy, would I hate giving people that news too. But I guess it's better to know what to expect than to just read about it on the internet and build it all up in your mind to something that may be so much worse than it actually turns out to be. Well, I think I'll make this the end of part one. It's sort of emotionally taxing to go back over, and not that I can put it out of my mind. It's always in my mind, but when you're not focusing on it, after a while, humans are very adaptable, and you just sort of work around this major thing that's going on in your life and get on with other things. And it's never completely out of your mind, but it doesn't have to be the focus. But of course, to spend time here talking about it really makes it the focus. So I'll just leave it now at I'm having the chemo. My oncologist said that I'm the poster child for having a good response to the treatment. So they like everything that they're seeing. But anyway, this is the end of part one. Hi, I'm Paris, and I'm in week 6 of proton therapy radiation for prostate cancer. Got my diagnosis 10 months back, and I wanted to go back and finish explaining how I came to the decisions on my treatment and the whole roundabout path it took. And having a definitive prostate cancer diagnosis, I knew 2 things. One is I wanted to have my treatment at the world famous Cancer Center in Houston, Texas. I'm in Austin, Texas, a mid-sized city in the center of the state. Houston's about 3 hours away, and I was willing to go there as many times as it took to get my treatment. And number 2, I wanted surgery. I wanted the prostate, the cancer, just cut out and removed. And I want to mention here, I'm not a doctor, no medical training, so this is just anecdotal information. These are the decisions I made, what I learned about. You should learn as much as you can and discuss all these things with your doctor. So did I end up having my treatment in Houston? Nope. Did I end up having surgery? Nope. Here's how it all came to pass. The urologist I had been seeing for several years, and the one who took me through all of this process of getting diagnosed, including doing the prostate biopsy, when the results came in, he said, "Well, I'm a diagnostician. I don't actually treat the cancer, so I'm going to hand you off to a couple other people in our organization, the surgical urologist and the radiation urologist." I got appointments set with both of them in Austin, 2 or 3 weeks out from that date. But as soon as I was home, I was calling the Cancer Center saying, "When can you get me in for a consultation?" So I had to get all my scan and test results sent over to Houston, and they were able to see me about a week after that. And it's quite an amazing place, incredibly large, but they have so many facilities there that whatever they decide they need, you need the MRI, psh, they send you over there, you get the MRI. They get the results right back. It's not like in a smaller town where it's all separate organizations that you as the patient have to try to get to work together. Big plus for going to a cancer center for getting your cancer treated. Now, the first person I saw doctor-wise was the radiation oncologist, who asked me from the very start, "Are you more inclined to want to do surgery or radiation?" And I said surgery because I'd already made up my mind about that. And they said, "Okay, I see. Well, there's still a good chance you're going to need radiation too, because when they take the cancer out, they may not get all of it in that area or lymph nodes around. So we recommend in your case doing after the surgery, we wait a while for you to heal, and then we'll probably have you come back to do the radiation." So that's going to mean a lot more trips to Houston, but okay, I'm committed to this. The next doctor I saw was a surgeon who asked me, "So how was your conversation with the radiation oncologist?" And I said, "Yeah, we talked about it, but I want to have the surgery. I think that's the right choice." He brought up the MRI and was able to show me the the cancerous part, because it had gotten outside of the prostate itself and was actually running along one set of the nerves. You have a couple sets of nerves down there that run the whole operation, and unfortunately, if those nerves get cut or damaged, then you can lose the function. You can be impotent and or incompetent, also both to varying degrees. It depends on how much nerve function can be spared, and so they try to do a nerve sparing surgery usually. But from what he showed me on the computer screen of the MRI, the cancer was right up along one of the sets of nerves. So he said, I have to tell you up front, we'll have to take that set of nerves along with it. We'll try to spare the other set of nerves, so you'll have some functionality afterwards. I thought, well, that's not great, but right now I'm focused on staying alive, and surgery seems to be the way to go, so sign me up for the surgery. So he did. I had a surgery date about 5 weeks, I think, after my appointment. It was right before Thanksgiving I was scheduled to go in for the surgery. Now, they had me stay to do some additional scans and tests, one of which, I didn't even know all the scans that they were doing, but one of which is a whole body scan looking to see if the cancer has spread. My scans came back as they saw they didn't detect that the cancer had spread anywhere, so surgery was on. I went back home, told my family, surgery's right before Thanksgiving, so let's start arranging our schedule for this. And I almost forgot, I still had the appointment with the doctors in Austin. So I was thinking of just canceling those appointments, but my wife said, no, go ahead. It's sort of like a second opinion, see what they have to say. We were completely expecting that they would say, yeah, that's the best choice, and the Houston Center is great. You should probably have everything done there since they've got you in. Well, I first met with the surgical urologist, and he didn't agree with that was the best plan. He said, you're younger than a lot of prostate cancer patients. He said, we look a lot of times at like the 5-year survival rate, but in your case, I think we should look at the 15-year survival rate. Let's see both the survival rate and the quality of life at 15 years for you. He agreed that I should have surgery done. However, of course, he thought he should do it. Plus, they have the same kind of high-tech Da Vinci robotic equipment. So anyway, he said, yes, you should have the surgery. However, you shouldn't have the surgery first. He said, because of where those nerves are and that the cancer is along that, he said there's a different route we can go that he thought was good for a couple reasons. And that route is to have chemo first. And I hadn't even considered having chemo. I didn't know that was a thing they usually did for prostate cancer. And he said, yeah, for the younger patients, we sometimes recommend this, and we've had good results with it. You go in and have chemo, which is rough, but it's better to have the chemo now when you're younger than having to go through chemo in your 70s should you need additional treatment for the cancer. So he said, you're young, you can get through the chemo, no sweat. There was some sweating involved. But the main reasons for doing the chemo is, one, I had stage 3 prostate cancer, and it had gotten outside of the prostate itself, even though they didn't detect it anywhere else. He said, you likely have some of those cancer cells floating around. Let's try to kill them off now. Do the chemo for that, because there's no other treatment that can go throughout your whole body, find the cancer cells and kill them. And number 2, equally or maybe more important, he says, I think if we do the chemo, we'll get that the cancer to shrink back up. And if we can get it to shrink back up away from those nerves, don't have to take out those nerves. Well, that was awfully tempting. I asked him, I said, are you okay with me talking about this with the surgeon in Houston and see what they have to say? He said, sure, go ahead, tell them about it. He said, now, as I mentioned, we've done this with a number of patients here. I work with a medical oncologist who takes care of the chemo part, so you're under their care for a few months, then they send you back to me, we do the surgery, and you'll still need the radiation. So you're going to talk to the radiation person in our practice as well. But that's really what I think you should do. So I said, well, let me think about it. He said, yeah, you think about it. I did then have my appointment with the radiation urologist, and it's pretty much, I understood this, it's the same sort of setup that they had in Houston, but I just imagined the Houston one was better. So I sent an email to the surgeon in Houston and said, here's what my doctor in Austin thinks. What do you think about this? Is this something we could do in Houston? Because in Houston, I'm sure it's going to be better. And their medical assistant wrote back and said, oh, the doctor says, no, we would not do this. It's not the standard treatment for your stage prostate cancer. But he was going to be pretty inflexible about it and just do it by the book. That's all he was willing to do. Well, the more I thought about it, the more it made sense to try to shrink the cancer up and get it away from other important things so they wouldn't have to be removed in the surgery. And ultimately, I decided to go with the chemo first, and then the surgery later, even if that meant having the surgery in Austin. One other thing, and I suppose it wasn't a big thing in making my decision, but it bothered me that when I was in Houston, in the waiting area between the various visits and scans, they had vending machines and they were all full of junk food. There was no healthy food on offer there. And I was at the time reading a book by someone who was diagnosed with prostate cancer and learned that a lot of the cause of that can be your diet and nutrition and lifestyle factors. And they were working hard to improve their nutrition, improve their health, their immune system, and fight back the prostate cancer that they had. So seeing the vending machines at the world famous cancer center full of junk food with no healthy offerings, that was really off-putting. The other thing was, I don't know which test it was that I had to do, but I had to drink this, I don't know how many, 20 ounces of something that maybe it was radioactive, I don't know, but it was going to go in and do something in my body, and then they would do another scan, and you could have that stuff you had to take mixed with another drink. And they had, Sprite was the standard one. They were doing that for people. They would mix it in with Sprite and you would drink that. You had to drink it in about 20 minutes. Here, again, you've got sick people. Some of the sickest people, they already have cancer, and this is what you're giving them to consume. I had my radioactive isotopes on the rocks just mixed with plain water. But it's stuck in my head, all these people drinking their big 20-ounce Sprites and thinking, oh man, this is how we all ended up here in the first place. So I canceled my surgery at the cancer center in Houston and met the medical oncologist that was going to oversee my care while I was doing chemo. That was a rough several months. I've documented that in another series of videos. I'll link to that at the end of this video so you can check those out if you like. But I'm going to jump ahead to I finished chemo, and yes, the doctor was right. Yeah, you can get through it. I didn't get through it no problem, but I did get through it. And so during those 4 months of awful lot of time being home, did a lot of reading, read some more books about prostate cancer, people who'd been through it, the treatments that they chose, as well as did a whole lot of research online. And I decided I didn't want to have surgery after all. So with surgery, there's inevitably some risk involved. There's risk to your life. There's also risk in the area where they're doing the surgery. They try to spare the nerves. They may not be able to. There's different bleeding that can happen. Stuff can happen when they're doing something in this fairly major surgery. And they told me I was going to have to do radiation anyway. So if the choice is to do surgery and radiation, or radiation, I think I'll choose radiation and skip the surgery. By the way, my results after the chemo were very good. Apparently I responded very well to the treatment because the cancer shrunk up all the, what they call the extra capsular cancer, the stuff that was outside of the prostate. There was completely, it was gone. And even inside the prostate, the little light dark signals they usually see to see where it's cancerous, they almost couldn't see that. So the chemo did a really good job pushing that cancer back, shrinking it up. So this is a good time with a smaller target to do the radiation, I decided, rather than to still have to do the surgery and then the radiation. But then as I learned more about radiation treatment options for prostate cancer, there are a number of them, including one that's quite a bit different than the others. It's called proton therapy or proton beam therapy. Rather than using a high-powered X-ray machine to shoot the photons into you to administer the radiation, the proton therapy uses protons. Well, how are they different? Well, protons are actually in the center of the atoms, and they put them in a particle accelerator, and they whip them around and get them up to like 2/3 of the speed of light, and they shoot them into you. If this sounds high-tech, it is. If this sounds expensive, it is. And if it sounds like something they don't do in every little town, it's not. So there are only a limited number of proton therapy centers in the US, even in the whole world. It's, I think, the best form of radiation if it will work for you because it has fewer side effects. Because radiation, I'm sure as you can imagine, is not without side effects. So proton therapy, that's what I want. So when I went into my medical oncologist for my last visit, and she said, okay, we had all these great results, and so we'll send you back over to arrange the surgery now. And I said, yeah, I kind of changed my mind about that. I want to do radiation, Not only that, I want to do this very specialized form of it, the proton therapy radiations. She said, oh, well, you're in luck because our organization is affiliated with the Proton Therapy Center up in Dallas. So we can arrange that. We'll have you work with our radiation oncologist here. So she handed me over to that doctor, got that stuff all set up. Still had to go tell the surgeon, the Austin surgeon who had set me up for doing the chemo and then to come back and do the surgery, that I wasn't going to be doing that after all. But he took it well, was very nice about it, said, I wish you all the luck with that. We've sent other patients up to Dallas for that. We've had good results. I'm sure you will too. A couple months after you're done there, you should come back and see me and we'll do your follow-up care here. And here I am in week 6 of 9 of receiving 44 proton therapy treatments in Dallas. And part of why I wanted to return to this topic and make this video is I think a lot of men are probably like me when they get the prostate cancer news. Severe panic and let's do surgery, cut this thing out right now. Don't go looking at any other options. But in my case, because I had a doctor who was considering my age more and had done a little bit different treatment protocol than is usual, he opened up my eyes to, well, why don't we do the chemo first, shrink the cancer down, that way the surgery, you won't have as many side effects from it. So that was good. But then, because I had those 4 months of chemo to think about things and to read and research more, then I learned, well, if you're going to do the radiation after the surgery anyway, why not just do the radiation and skip the surgery? And then I learned about proton therapy. So I ended up on a cancer treatment path that I didn't even know existed when I was first diagnosed with prostate cancer. And I know a lot of men must respond like I did, cut it out and do it now. But if you can take the time to research other options and see what experience other men have had, consider the side effects, consider the quality of life, and consider strongly how you're likely to end up physically after your cancer treatment, because you may have quite a few years left ahead of you and you'll be spending them in whatever shape it leaves you. So if you can take at least a couple weeks, get a second opinion, do some reading, some research, and at least be aware of all the options so you can decide between them before making this very important decision that will affect you for the rest of your life. I will link to the books that I read that I found were very helpful in making my decision. I'll link to them down below this video. And I can tell you that proton therapy, for all of its fewer side effects, is not without side effects. I'm in week 6 right now, and I have some things to share about that, which I'll do in a separate video, and I'll see you on the next review.
There are so many choices and you don't want to stress. You want your health food at home, receiving only the best. That's what we're here for. We give honest reviews. parristx.